It's time now for the Business Spotlight on the WMAY newsfeed. It's sponsored by SIU Family Medicine, and Dr. Jamie Wallman is here with us today. Works in family medicine there at SIU. And doctor, we're talking today about something that it's really important, but I think for a lot of people, it feels really daunting and complicated when you have to find a physician, maybe change your physician, and become a new patient someplace else. That we're talking about today is about bringing in new patients there at SIU Family Medicine. And is this something that routinely happens where the clinic there, the SIU Center for Family Medicine, is accepting new patients? How does the process work?
So we are pretty much always accepting new patients. We have approximately 30 physicians, nurse practitioners, physician's assistants. So there's pretty much always somebody taking new patients. We also have a residency program where we have 30 residents who are doctors that are under supervision that are taking new patients as well.
We may have somebody new to town, or maybe their doctor has retired. Lots of different scenarios where someone might need to find a new medical home. What do people need to bring with them? Is this material just generally transferable from one office to another? Do people need to start compiling records and information? How do they start that process?
So when you come for a new appointment, you want to bring your ID or driver's license, bring your medical card or insurance card. Bring a list of medications, or better yet, bring all of your medications in a bag physically with you to the appointment. That includes over-the-counter medications, prescription medications, any vitamins, supplements that you take. Bring them all with. If you have some old printed medical records, that would be great. That could help us jumpstart the process of your care. If you don't, we have a medical records release form that you can sign, and that will notify your old doctor's office to send us the records that we need for you. And if you have somebody that helps take care of you, if you have memory issues, things like that, you may want to bring your caretaker or a family member along that can help fill in any blanks that you might have in your history.
We hear a lot about the benefits of having a quote medical home. What are the particular benefits of having a family medicine provider to be your primary care physician?
So, a family medicine provider can take care of everyone in your family, literally from the time they're born till the time they pass away. We can help coordinate all of your care between all your providers. We can do the vast majority of care in our office, but if you need a referral to another provider, we can do that. We can manage your chronic conditions like blood pressure, diabetes, and we can also help with any acute things you might have, like if you're coming down with a cold or get a sore throat. A family medicine doctor is really good at preventive medicine, so we help try to prevent things before they get started, kind of nip things in the bud. Um, so people that see their family medicine doctor regularly and adhere to their medications typically have fewer hospitalizations and ER visits than those that don't.
We're talking with Dr. Jamie Wallman of the SIU Center for Family Medicine. And doctor, would it be safe to say that the vast majority of problems or ailments that a typical patient needs medical assistance with could be handled by a family physician?
Yes, definitely, definitely. It's always a good idea to come see us first. And if we feel like we need some extra help from some of our other physician specialist colleagues, we can get you in typically faster than what you would be able to get in if you just called yourself.
It's really important for people to feel comfortable with their doctor. Is there a sort of a process, I guess, people should use to determine the best place to find that medical home, to find that right doctor for them?
Well, we have a website, siumed.org, siumed.org. You can go there and visit the different specialties. And within the specialties, you can see the physician bios to see if you think that they might be somebody that's a good fit for you.
And so ultimately, if I am ready to find that next physician and I would like to come to the SIU Center for Family Medicine to do so, how do I really start that process?
So, lots of different ways you could do that. The website that I just mentioned, siumed.org, they have an online appointment request form that you can fill out. And if you want to request a certain physician there, you certainly can, or you can be randomly assigned to one. You can also call our phone number for SIU at 217-545-8000, Or if you're in the neighborhood and just want to stop in, the Family Medicine Center is on 4th and Carpenter, and you could come in and talk to our front desk staff who could set you up.
For your own wellness and the wellness of your own family, it's a great and important first step to get yourself in and become part of the SIU Center for Family Medicine. Dr. Jamie Wallman, thank you for joining us here in the Business Spotlight. We appreciate your time.
Thanks for having me.
The Business Spotlight here on the newsfeed, WMAY on 92.7, 94.7, and 970 AM.